Hi, I'm Chris Porter. I'm a general surgeon, and I'm talking about digital communities and surgical education. This is my disclosure. These are the learning objectives. Remember that day we showed up for school and we heard the bell ring and we were making our way to our desks and we looked around and realized that no teacher had showed up? That's the digital landscape for surgical education over the past several years. It's just starting to change, I'm glad to say. But the digital landscape for surgical education is a classroom full of people waiting for the educators to show up. Who are the educators? Who educates a surgeon? A community does, and this is the community as I saw it in the 90s during my residency. It consisted of the surgeons we knew who were imparting their knowledge to us and directly instructing us on how to remove organs. They served as our mentors. Then there were the surgeons who filled the book stacks with authoritative texts and with our periodical literature. Then there were gatherings of surgeons, and this is where I really felt most our community. And this is where we got to see our heroes on a stage. We had our professional identity strengthened, and we got a bolus of education. And that was the surgical education community as I understood it in the 90s. And that community was enabled by particular technologies and limited by geography and the technologies of the time. But our technologies have changed pretty substantially since then in what's available to the world. Consider this web-enabled cell phone and what this woman has available at her fingertips in terms of information access and the ability to navigate that information with good search tools such as Google. Compare that to this woman trying to navigate these bookshelves. We required a librarian to help us to try to find a couple of relevant articles over the course of weeks sometimes from this mobile technology, which was the standard of the time. This woman also has many more ways to communicate and thus more ways to associate and form communities. She can call somebody, leave a voicemail, she can text, she can Skype, she can FaceTime, she can communicate through Facebook, and all those ways of communicating have enabled her to associate with people in a different way. And the best example of this in my mind is my own Facebook page, where I am in communication with people who I didn't expect to communicate with after our high school reunions. And I have people who I communicate with on Facebook who I've never met in real life. So these technologies have enabled us to communicate and associate with people we wouldn't have otherwise. These technologies have also enabled us to publish and broadcast in pretty amazing ways. Consider 30 years ago if you had a bright idea that you wanted to share with your 200 best friends. Or consider if you had taken a photograph that you wanted to share with 500 million people. If you had taken that photograph 30 years ago, how would you share that? Well, today, if this woman chooses, she can snap a photo of herself with her new friends, create a caption for that photo, and publish that and make it available to the people on Facebook, which are 500 million people. She can publish with the click of a finger, and she can do that in about the time it took me to explain that. So, the surgical education community as I knew it, the surgeons we knew, the surgeons who wrote, and surgeon gatherings have been vastly expanded, in my view, by surgeons who interact online. What else has changed because of changing technologies? Well, the interns that you will see in this summer, beginning in July, were born in 1988, I regret to inform you. And when they were in junior high, they were interacting with complete strangers on the other side of the world playing games digitally. And when they were in high school, they were creating profiles and posting photos of themselves for the world to see. In college, they were posting drunk and naked photos of themselves for the world to see. And if they cleaned up their profile, they might have got into medical school, and they are still continuing to find new tools for communicating and for sifting information on the internet. And now they are grown up, they're doctors, they're going to start to behave like adults, they're going to put away these tools, they're going to stop texting, they're going to get off social media, and they're going to put away their cell phones, right? Wrong. They're going to continue to use these things because they are important tools. And these people understand these technologies. They've been using digital technologies in their education their whole lives. And it is us, the educators, and not the learners, who need to learn the value of web, social, mobile tools in educating future surgeons and medical students. So what is a digital community? We think of these things, the social media platforms and the communities designed for doctor-to-doctor interaction. But really, a digital community is any group of people with shared purpose who are communicating by digital means. And we do that in our families, our schools, and there are websites all over the internet arranged to allow people to interact regarding certain interests. And why do these communities exist? They emerge out of our need for them. This is my first digital surgical education community. I was operating in Africa and needed additional supervision, and this was my cry for help. I sent an email home to many of the senior doctors in my hospital and got fabulous point-of-care help in managing patients. And my patients benefited from it tremendously, and my education benefited from it. And I still crave answers. This is a surgical education community I created about 3 years ago. And I created this in my effort to get answers to my own questions and to hopefully supply some answers to the questions of medical students and surgery residents. And this community exists both on a website and now is more active across social media on Twitter and Facebook. And what are the advantages of digital communities? The big one is access, of course. You don't need to be in any particular place. An internet connection costs a lot less than flying to conferences and paying for hotels. You don't need to be available at any particular time. You can participate in digital communities when it fits your schedule, or you can participate in live events as well. And there's also a different interpersonal dynamic that occurs in digital communities, and we'll talk more about this a bit later. So when are our medical students and residents using these digital communities? Well, look at the world's go-to digital library, Wikipedia. This is a resource created by a community of volunteer educators. And if your students and residents aren't accessing Wikipedia every day, then they probably got the wrong cell phone plan for your hospital. Is Wikipedia the ultimate authority? No. But authoritative resources are bypassed all day long in favor of accessible resources. And students are savvy enough to know when to use these sort of resources. They will use this for foundational knowledge and for anatomy, and not particularly for patient management decisions. They won't go to Wikipedia to decide how big a margin to use for excision of a melanoma. They're savvy. How about YouTube? I hope my residents have visited YouTube before they scrub their first mastectomy. YouTube is a digital educational community. It's surgeons who created these resources. And in some ways, YouTube is a better learning resource than a live operation because you can stop and rewind. You can watch just one portion of the video. You can watch several techniques. Andrew Wright is a surgeon at the University of Washington, and he has created a great series of instructional videos for medical students and residents, including suturing techniques and minor procedures. So these are terrific resources for medical students and residents. They also use these networks as peer-to-peer sharing resources. Hey, I found this open access resource over here on this webpage, and it really helped me to pass the shelf exam. Check it out. Here's the link. Oh, hey, that was a great resource, somebody responds. I found this other one over here. You should check out this open access resource. Here's the link. Check it out. So they're helping each other with peer-to-peer sharing. Also, these networks are good for career guidance. Here's an example of a medical student asking a question of a seasoned surgeon, Dr. Skeptical Scalpel. We'll talk more about him later. But this is an example of the flattened hierarchy where a medical student feels comfortable approaching a surgeon that he probably wouldn't have access to. Certainly he doesn't have access to Skeptical Scalpel in his living room, but he can communicate with him online, and they can have a conversation, and this conversation will serve as a resource for future students, unlike conversations that take place in real life, which don't last long on archives. This slide demonstrates a couple of ways that digital networks are useful to students and trainees. This is a woman who's serving as a voice for her peer group of medical students in a blog post, and she created this blog post for the Association for Academic Surgery, and she accidentally stumbled upon a career opportunity for herself. This is a woman with a talent for writing and online engagement. She writes this blog post, and the people who responded to this blog post were falling all over themselves to offer her a job. She really distinguished herself as a leader of her peers, and she was offered fellowships and jobs, and she wasn't even applying for these jobs. She just she got job offers on the comments section of her blog post. So the role of digital communities, recapping, for medical students and future surgeons. They use these communities as a digital library for peer-to-peer sharing, for career guidance and professional networking, and they use these communities for advocacy. There are some challenges to these communities, of course. When they're used to using these things for other things and they're used to using these platforms for other purposes in their adolescence, they have to make a transition to using them in a professional setting. So what are the opportunities for educators in digital communities? Well, who's going to build the digital library for future surgeons if not us? We can create resources. We don't depend on the traditional publishers as we once did. We can publish ourselves. And here's a surgeon who's doing just that. He has created a library of high-resolution videos of complex surgical complex cancer cases. And he's got 14,000 people following him on his Facebook page. So this is a tremendous open access resource. Educators can also use these for sharing best practices and educating one another. I use this community here. This is a Facebook community created by surgeons who do a lot of complex hernia procedures. And we can see complex cases presented right here. We can see CT scans, we can see their pre-op photos, we can sometimes watch their operative videos. The surgeons involved here are sharing their post-op pictures, and we can actually interact with one another, ask questions, and crowdsource patient care, and we can watch the evolution of the standard of care right here on Facebook. So what's a blogger? Bloggers are the central members of the social media communities. They're content creators, they're analysts, and this is Skeptical Scalpel. I would call Skeptical Scalpel the most important digital voice in general surgery. He's an experienced surgeon, he's a talented writer, he's insightful, he's no-nonsense, he's funny, and he's retired, which is important because this allows him to keep abreast of surgical news and trends. He's got the time to commit to this, and he's also anonymous and wears a mask, which I think is cool. He's sort of like Batman. And he has a very wide audience for his readership. He offers an insider's perspective for surgery in the lay press for non-medical people, and he gives perspective relevant to patients, to students, to trainees, and to his peers. This blog post here, created to educate about statistical significance versus clinical significance, this blog post, Skeptical Scalpel says, has been read by more people than all of his published literature during his long academic surgery career. So this is really a way of reaching people, these digital communities and blogs. Here's a blogger who writes with more of a tight focus in his area of specialty, and he offers expertise, and he leads high-level clinical discussions, gives technical tips, and discusses transplantation ethics. And the other thing these surgeons are doing is they're building their digital brands and reputations online. You know, we care a lot about our reputation and brands in the real world, and we should also care about our brands in the digital world. If we don't create them, sometimes they're created for us by those Rate Your Doctor websites and such. Here's a group of British surgeons using digital networks for advocacy. School of Surgery advocates for global health. They advocate for open access resources. Their main thrust on the internet is creating open access summaries of the current literature, which is often closed accessed or paywalled, and then they direct people to those open access resources through Facebook and Twitter. Here are a couple of networks for research collaboration. There's a strong effort from the world of all scientific researchers to enable collaboration for data sharing, as well as a push for open access publication. The question is, why do we continue to use our traditional publishers who do not make this information as available as these networks? Shouldn't we be using networks which make our data and results open access? Here's a group of Twitter surgeons who met online, so to speak. These are surgeons from various institutions who know each other from Twitter and recently met at an academic conference where they were reporting on this conference. And really, they brought this conference to me in my living room by live tweeting the conference, conveying the material in the presentations, as well as sort of the atmosphere of this conference. It was really neat to be able to feel like I was participating in this conference from my own living room. They also serve as curators, finding content that's available, or finding whatever is relevant to surgeons, educators, students, residents, and pointing out that information on Twitter so that people following them on Twitter can find important resources relevant to general surgery. This is the first journal club for general surgery, which spawned out of the conversations around that were occurring around that academic conference recently. And this Twitter General Surgery Journal Club held its first meeting last week, March of 2014, and it's going to hold a journal club every first Monday of the month. And these are live Twitter events where, for example, last week, Dr. Justin Dimmick, who does research in quality metrics, was able to talk to people who'd read his article and discuss it live. So this is a Twitter club where 250 people were able to take part in this Twitter meeting and participate in a journal club. And the nice thing about this is this journal club conversation will be forever available on Storify here. So they're archived and available for future reference. So recapping on what early adopter educators are using digital communities for. They use it to curate, to create, to collaborate, to connect, and to converse. So this group of surgeons participating in digital communities has really expanded our surgical education community, in my opinion. The bell has rung in the digital classroom. The students are waiting for us. Let's get online and teach. Thank you.